Measles Madness, everything you need to know about the measles disease. Measles disease, what causes measles and should you get vaccinated? The measles has received a lot of attention lately. What exactly causes measles, and should you get vaccinated? Is this just hysteria, though? A virus called the measles has a protein shell, RNA, and other proteins for replication. It requires a host cell to multiply. It is unable to do so on its own. We must comprehend the immune system in order to comprehend the measles. You may have previously seen the graphic system we created to aid in this. Let's now concentrate on the immune system components that are pertinent to measles. Measles disease, how the measles virus affects the body. Humans can contract the measles virus through their mouth, nose, or eyes. Infection with measles begins in the lungs. The body's first line of defense, the powerful guard cells known as macrophages, which guard the lungs from invaders, are particularly susceptible to infection by measles. They walk in and take control of a cell. The virus reprograms the cell, turning it into a potentially harmful virus production facility. Once a cell is overrun by viruses, the cycle is restarted when the virus-filled cell is destroyed. However, the immune system's natural killer cells are potent weapons against viral infections. These cells essentially patrol the body and look for infections in other cells. They direct an infected cell to kill itself if they detect one. You won't even know you have the measles for the first 10 days or so because to this treatment's exceptional effectiveness. Measles disease, why measles is such a potent disease. Here is why measles is such a potent disease. Macrophages signal the brain of the immune system, the dendritic cells, after a time of battling and dying. Dendritic cells have the responsibility of gathering samples of invaders, moving to the lymph nodes, and then turning on the powerful weapons that quickly destroy the illness. But the measles virus employs a terrible strategy. Dendritic cells are infected, and it exploits them as a Trojan horse to get deeper within the body. To warn other immune cells, the contaminated cells move on to the subsequent lymph node. The measles virus enters and spreads across the undeveloped T and B cells. It targets the system that developed to combat it. Things move quickly now. The virus is disseminated by the lymphatic system, which also allows it to pass into the circulation and infect cells. What measles does to your body, spleen, liver, intestines, and more. Spleen, liver, intestines, and, most significantly, the lungs are among the organs that are affected by measles. The signs and symptoms include a rash, a very high fever, headaches, nausea, and bronchitis. The immune system in the lungs was functioning fairly well. But now, many viruses launch a second attack and decimate countless cells, eradicating the protective mechanisms. You begin coughing up millions of measles viruses during this stage. At this point, there is a 90% risk that you will infect someone if you come into contact with someone who has not received the measles vaccine. Without the lungs' defenses in place, other bacteria or viruses that ordinarily wouldn't have a chance in hell might suddenly infiltrate the lungs and grow into dangerous parallel infections that can result in pneumonia, the most common cause of measles death. Measles, a disease that wreaks havoc on your immune system. The immune system in your body has now been severely damaged. Various defense mechanisms are damaged and thrown off balance. Everywhere it goes, the virus spreads and infects the skin. Now you can see the classic measles rash. Additionally, the measles virus can occasionally invade the brain and result in a brain infection. If it does, it has a 20 to 40% risk of death and a possibility of long-term injury. However, your body still fights back forcefully at this point and is far from giving up. Some dendritic cells endure long enough to stimulate the body's natural viral defenses. Millions of antibodies, which are small proteins that mark infected cells for destruction or group the virus together, are produced by plasma cells in the lymph nodes. Killer T cells inundate the body and decimate all contaminated cells. The body typically gains the upper hand and vanquishes the infection within 2 to 3 weeks. But because the immune system has been severely compromised, it may take weeks or months for it to fully recover, making the body susceptible to subsequent illnesses. However, if you survive, you are now immune since the immune system will always remember the infection. Don't laugh at measles, 122,000 died from the disease in 2014. The measles is no laughing matter. Despite the fact that 84% of people have received the measles vaccine, 122,000 people contracted the disease and died as a result in 2014. Some people are unable to receive vaccines due to a variety of factors, including being too young, undergoing chemotherapy, having HIV, or having an allergy to the vaccine. For their benefit, the rest of us must stop the sickness. The measles vaccine is affordable, safe, and widely available. Having the measles has no advantages at all. Your immune system is not strengthened, nor is it more natural. Yes, you are putting your child at risk by not vaccinating them against measles. Most people who choose not to vaccinate their children genuinely want what is best for them, which is admirable. But if you reflect on the question, am I putting the lives of my child and other children at risk by refusing the measles vaccine? Sadly, the answer is yes. You are, in fact. Let's avoid assigning responsibility, though. Let's cooperate to get rid of this virus.